guys, I'm Dr. Alicia Isom. I'm a third-year pediatric resident over at Palms West Hospital. So I've kind of been where these guys have been at. You know, you start out in high school, you're working hard to get the good grades to go to college. Once you're in college, you start thinking, hey, maybe I want to do the medicine thing. You guys are already kind of on that first step, so you know, keep at it. Once you're done with college and you go off to medical school, once you're done with medical school and you decide what you want to do in medicine, then you start your residency program. You know, whether you want to be a surgeon, whether you want to be a pediatrician like I am, whether you want to be an ophthalmologist like Dr. Anderson, you know, whatever you want to do, there's definitely steps that you got to take. But find something that, whatever you do, make sure it's something that you guys love. So don't let anybody tell you, oh, you shouldn't go into that side of medicine because, you know, you'll have to work too hard, or you know, you won't make a whole lot of money, you should do something else. You know, go with what you love. Go with what you love and you'll never work a day in your life. That's my philosophy. You know, you gotta work hard, you gotta stick with it. You know, certainly the grades are important. You know, don't let money be either a deterrent or your main reason for doing this. You know, it's all about, at the end of the day, it's all about helping people. It's all about getting people to living healthier lives. You know, you just gotta find what you love, whether it's nursing, whether it's being a doctor, whether it's being a phlebotomist, anything. Just find what you love and go for it, and don't let anybody tell you otherwise, that you can't do it or you shouldn't do it. You just gotta go with what you love. So for me as a pediatrician, I'm the one that's taking care of you guys, you know, from the tiny little babies all the way up to, you know, to high school students and kids going off to college. I think you guys will agree that kids are a lot more fun than adults, but there's definitely some fun adults out there, as Dr. Anderson's going to show you shortly. But it's an investment in yourself, like they were saying. It's putting the time in. Knowing what you want to do and going for it. You know, you just really have to work hard at it. Make sure you guys are staying on task. Make sure you guys are doing everything that you need to do to set yourself up for a better life, not just for yourself, but for your family. And you know, don't sell yourself short. So that's what I gotta have to say.
Okay, was everybody hearing me at first? Yes. Yeah, so we give enough blood flow to the baby so the baby doesn't die. When do we know a baby's going to be born? A baby can be born at any time. And when I started pediatric cardiology, you might just get home at 8 o'clock, and all of a sudden you're back in the hospital by 9. Now we know prenatally, and sometimes you don't have to come in the middle of the night, but I'm always prepared to go in the middle of the night. So let's go ahead and start. This is about a patient, and the patient's not here. You know, there's health protected information. We can't talk about patients. I can't talk about you know, what you have. We can't do that. But we can talk about patients in general. And this was a patient I had. I just got home, and I went, oh, and the ER doctor called me. He says, I have a patient here. He's 16. Here's his story. He's out playing basketball with his friends on Saturday. Fine. Sunday, he didn't feel that good. Maybe he played a little basketball, maybe he didn't. He just wasn't himself. Monday, he said, I don't feel well, so he stayed home from school, and his parents went to work as usual. Tuesday, he stayed home again. He just didn't feel very good. And Wednesday, the father said, you know, let me go check on my son at home. He went home, and his son couldn't even walk. He was so sick, he just deteriorated, and because teenagers are not very communicative, you have to kind of look at them, notice how different they are from their usual status, okay? So he took him to the hospital in a city outside of West Palm Beach. Got to the hospital, the doctor there said, the heart rate's a little fast. I'm gonna send him down to West Palm Beach, where we have pediatric cardiologists. We're not everywhere, okay? Because there aren't that many pediatric heart patients, okay? So he got there, the ER doctor said, that's the first I heard of him when he got here, and the ER doctor said, this patient is here, and heart's a little fast, looks a little big on chest x-ray. I think maybe you should come in and see him. So I'm getting ready to come in. I call my echocardiogram technician. Remember we talked about ultrasound? I called the echocardiogram technician. She came in. She started doing the ultrasound of the heart, and guess what? The patient had a cardiac arrest. While she's doing an ultrasound, the patient stopped breathing. His heart stopped. The nurses ran in, gave him epinephrine, gave him Valium. You know, he came back around. He wasn't really conscious. Intubated him. He had a breathing tube. He was on a respirator. So I'm like driving widely, and I get there. His heart's big. The function's pretty poor. He's not breathing on his own. He'd been talking to the doctor on his way up the elevator. So the next thing you know, we say, you know, this is really rapid that this boy's heart deteriorated, because we know he was playing basketball 2 days ago, so he's in good condition. So we sent the patient to University of Miami, where they have not only heart failure, but they have transplant.
The person who's a retired ophthalmologist, and my name is Dr. Mildred Anderson. Actually, it's Mildred Renee Singleton Anderson. Actually, it's Mildred Renee Purifort Singleton Anderson. Now, the reason that's important is because my maiden name, Purifort, is Old French for pure faith. And my folks, my ancestors were slaves here. Been here for 400 years, okay? And so, when I was born in Birmingham, Alabama, my father had gone to fight World War II. Matter of fact, there were 3 brothers. One was drafted in the Air Force, one was drafted into the Army, and my father was drafted into the Navy for World War II. Now, most people, or I should say, at that time, white people, you didn't have to send all of your boys. But of course, at that time, it didn't matter with blacks. They just took all the boys, so there were 3 boys. And they fought in North Africa and in Europe and came back home, all 3 safe. Now, their family were sharecroppers around Selma, Uniontown, Alabama, and so forth. And so when they came back, well, the white boys had come back, and there were too many men coming back for the field, so there wasn't enough work. So my father and his brothers and his father, they went to Birmingham. And there still wasn't enough work. My father was a skilled mechanic, still couldn't find enough work. So then they went north. You guys, in your history classes, do you learn about the northern migration of African Americans? No. Okay. Well, that was around the time I was born, in 1945. Does that make me what? 70 years old? 70 years old this year.
Yeah.
70 years old this year, that's right. And I was an ophthalmologist for about 30 years, and then all of a sudden, I got sick. I had a thyroid storm, and my blood pressure, because the weakness in my family is hypertension, high blood pressure. But I had never had a problem with high blood pressure. And quite frankly, when I was a teenager and went to medical school, and I was one of those people with the scholarships all the way through undergraduate and medical school, my mother died. She was 44 years old, had 8 kids. Massive stroke. Can you imagine 8 kids? I come home from medical school, and house was cold, dirty, no food, cooked, it was crazy. But that was the life that we had to adapt to. And yet we pulled ourselves together, we went on, and all of my brothers and sisters have degrees. Of course, half of them are dead now, right? Because that cardiovascular disease runs in my family.
There is not one person in the operating room who is the most important. Because the surgeon cannot work without the certified surgical tech.
And we need her or him.
The surgical tech can't work without SPD or an RN.
They're putting people to sleep and
And-
monitor all their vitals.
A case can't be done without a CRNA.
Now these are, this one here and this one here are subfields.
They're luxuries.
Yes, because every case is going to have a physician's assistant, which is an extra set of hands, or a first assist. That's extra in a great world. A lot of times where some of us have worked, it's just you and the tech and the doctor all day, and you might hold 5. Both.
Really?
Yeah.
Because this person needs to know almost everything that person does. And you're like, no, there's no way you don't go to school that long. You're absolutely right. We just know the basics. We know everything they're going to need, everything they're going to ask for, and we know how it goes together and how to take it apart and do it in the dark.
And
Because if not, they're gonna be looking down here and they ask for it and they want it in their hand, you're gonna give it to them. Because if he has to look up like this, they just bled out because now I can't find where he was working.
Like trauma?
I worked as a private trauma tech at Tampa General for almost 4 years with Dr. Rosemary and Dr. Ross, and it's the unknown. It's
Yeah.
unbelievable, the adrenaline rush to walk in the room and they just say you got a belly gunshots or whatever, and you're right in there. You walk in the room, or maybe you're leaving the ER on top of the gurney doing CPR into the OR.
During surgeries, we don't always put a tube down their throat, but most of the time we do. And it just helps the patient. And normally we'd inflate this, and you can see the lungs like inflating up, but they have the bag over there, so you guys can diagnose and medic. There we go. She just pushed us off. She's like, yes, there we go. All right, who wants to go next? Oh, come on over. It's not scary. Here, I'll hold this for you.
It's harder than it looks.
Okay, let's pull this out all the way. No, you're gonna do it perfect. Here you go.
So like every plus one, so 6 years.
So for those cords. There. Oh, that's perfect. There's the vocal cords. Now take this tube. You guys see what she's looking at right here? And right under here is the esophagus. This leads down your esophagus, which leads down to your stomach, guys. So you want to keep the tube up here, so it goes down through your vocal cords and into your trachea to your lungs. What are those things that are blocking? Are we talking about these right here? Yeah, just cartilage. It's like retinoids or corniculates and stuff like that. It's just the cartilage around your throat that goes down your throat. Here you go. We'll switch it. Who wants to go next? Who wants to be on the surgical team? Me. Okay, stand over here. Anesthesia team. You can stand over here. We need help with anesthesia. You guys can help out? Yes. Perfect. So we have our patient here.
Andy just came in and he's screaming and he's crying. We don't know what's wrong.
Okay, so as a PA, we need to figure out what happened, figure out how to fix it, and tell him what he has. Okay, so what's happening? He's coming in. What are you going to ask him?
Al, somebody help me.
What's wrong?
My leg.
His leg hurts. What are you going to do? What else? Do you need to find out other things?
Talk to Andy.
I was riding my bike and then
Doesn't look good.
and it opened. It fell. It's blood.
Where is open?
My whole leg.
Okay, so now you're going to perform a physical exam. You're going to figure out where it hurts, what's broken, what's wrong with him. So now we found out, what do you think is wrong with him? What's broken?
My leg.
Probably need to take an x-ray,
Where,
right?
where does he hurt?
My leg.
On his leg. So what do you think is broken?
My leg.
His leg, right?
Right, his leg, right? Okay, so can we just like start fixing it right now?
So now the PA, you make orders. So we're going to send him for x-rays so we can see which bone's broken, where it's broken, and figure out how to fix it, right?
So now it comes back and his leg's broken. Where do we take him? To the operating room. Good.
Let's take him to the operating room.
All right, do you think you can just start fixing it right now? Like try fixing it right now.
Try to move his leg.
Oh, you didn't like that. All right, so what do you think we need to make it better? So that, can we do it while he's awake?
No.
So what do we have to do?
We got anesthesia.
Anesthesia, all right.
Anesthesiologist over here. Okay, so now we're in the operating room. Okay, so now we're in the operating room.
Lord.
Can I start cutting?
No, we're not ready.
Okay, right? Yes. Tell him Andy's gonna be okay. Okay, cool. All right, what do you need to breathe? What do you guys need? Oxygen, maybe? So this is gonna put this mask on his face.
And just tell him it's going to be okay. I'm just giving you oxygen. This hand.
Okay, you wanna push the drugs?
Take this hand and hold the mask right here. There you go.
I'm just gonna pretend this is his IV. Now as anesthesia, we're responsible for the patient's whole body.
So we have to make sure he has fluids, he's breathing, he's doing okay, his blood pressure's okay.
Okay, 100 milligrams of propofol is in.
Okay, that's
puts him to sleep.
okay?
so watch his eyes.
Anesthesia, are we ready to go? Can we cut?
Yes, we're ready.
I don't know, are we ready?
Are we ready? Yeah.
All right, say it loud.
Yeah, he's asleep.
All right.
How do you know he's ready?
Anesthesia's ready.
Okay, so now the
Sleep.
PA, the surgical
Now
PAs
it's
can
easy.
start cutting, right? Because he's asleep and he won't feel anything. So now we're
Now
gonna
you start cutting. You gotta
cut
fix his leg
and
now.
we're gonna fix it.
So it's anesthesia, we also
What's
have
that
to
sound?
listen. So we noticed the beeps were high and now they're low, so that means that we look at the monitors, make sure he's stable, but his oxygen levels are low.
You see the purple flashing thing? What does it say?
It's
The O2, right? So we need to make sure that number gets higher. So is 60 a good number?
No.
No. Does anybody want a 60 on the test? No. What grade do you want? So we gotta give him oxygen until we get the number up to 100. So keep pumping. Keep pumping.
So right now we have to stop cutting. We can't do any more surgery until their oxygen goes back to normal.
Okay? Our goal is to keep him here. See you guys, it's starting to go
So
up.
now that we're just standing here, our hands need to be up. We're not allowed to touch anything. You can't touch anywhere around because
Keep
our
pumping
hands
until you get
are super
100.
clean.
Yep. Is it working? Yes.
It's going up slowly.
So y'all, we're gonna ask
You see his chest
this.
rise.
Okay, so now go ask anesthesia if we can start back
Okay,
again.
look.
100!
Okay, now you have to tell the PAs and the
We
surgeons.
don't know if we're ready to start. We have to get it from you.
So now you say, is he good?
Okay.
Ready for surgery?
Can we continue? Can we close him up? Can we suture him up? Okay, so now we're closing and we're suturing and we're doing everything. Remember, hands above the waistline, right? Always.
So now that we're done with our surgery, now what has to happen? What does anesthesia have to do?
Wake him up.
Wake him up.
Wake him up. There you go.
I think the one important thing for the role that they play, so patients come in and they have to take pictures so that the radiologist or the doctor can determine what's wrong. And then from there, your course of treatment is then determined and, they'll do whatever they need from that point. But without this, the technologists, the doctors can't do what they do. So that's why this is such a critical position to, to consider coming in as a profession, because you get to use some of the most advanced technology out there, and you get to work with patients, and then you provide the doctors with the information. And it depends on how good they are. The quality of the information really will help make the best decisions for your patients. So it's a really important role. And I guess that's kind of a good segue.
It is a
Perfect
brilliant, 'cause we
segue.
also work with a lot of different equipment.
Yeah.
And the latest equipment.
So that's the hospital side of it. I represent the manufacturers. So my company is GE Healthcare. We are a $17 billion company. And what we do is we innovate new products so that they can, provide the best care in the medical field.
You want to be a JAG in the Army? That's very good. I spent 22 years in the Army. That's a good, they don't pay as much as civilian lawyers, but they got good benefits. So
And then
you
if
stay
you're
there for
looking
20 years and
for-
retire.
And that's what Director Harrington was saying, that you need to follow those little steps, because, if the Army's gonna pay for it and you're gonna get your degree that way, then, that's a good way to go. And Director Harrington always says how much he enjoyed being in the Army. And I
Being an
have
Army nurse was wonderful. It's an experience that
I have a friends who wanted to be nurse anesthetists who was in the Army, and they went back and the Army paid for them to do their nurse anesthesia degree, which is like the cheapest out there is like $125,000 for the program. So it's a very, very expensive program. So, and the Army paid for it for them to be able to do it. So it's a good way to go. And well, one of the things that I noticed with you guys is that you all have goals and aspirations that require the same thing that nursing does, which is very strong and strict discipline. So you're going to need to make sure that you make plans and you look around at your family life and make sure that you study really hard so that you can get to where you want to go. And if there are things that happen because you guys are older, you're high school kids, and we can talk to you about that. And as nurses, that's what we do. We're counselors. When we see kids in the ER, as ER nurses, we always find an opportunity to educate the kids that we see or to educate the parents. If they have younger kids, we talk to them about home safety. For you guys, as your teenagers, you may have plans, but then something may come along. There may be a cute boy on the way that may distract you. But if you keep going on the goals that you need to, then you're going to get there. And it's the same thing that I tell all my nursing students. You know, sometimes they become despondent or they get upset because they didn't get the grades that they wanted to, or something happened, or they didn't do something the right way. And I always tell them, you know, find your way back to where you want to be, and nobody can answer those questions for you except yourself. And so you need to make sure that right now, being where you are, that you're making those plans to get there, whether it's nursing or any of the things that, any of the other career that you want to go into. And I think I like having the older groups because we get to talk to you guys more like adults.
Just, you know, make a plan. Make yourself a 5-year plan, a 10-year plan. This is where I want to be in a couple of years. This is my next step. This is my next step. And then you work toward those steps, because it's hard to, you don't go from here to here, jump. You gotta take it in increments to get to the goal you want to be.
5-year plan may become a 7-year plan, but it's okay as long as you get to the goals that you set for yourself.
Okay, when you put on your suit in the morning to go to work in this capacity, you need to also put on a thick skin, okay? And I'll get into that in a minute. All right, so let's get into it. All right, so what exactly does a pharmaceutical sales rep do? We are a resource to physicians throughout the nation, okay? We also act as consultants to these physicians. So you can go into an office and you can, what we call, information dump. What that means is you go into an office and you say to a doctor, "Hi, I'm Sean Hamilton. I'm here to talk to you today about this particular drug. Let's say Zoloft. Zoloft is an antidepressant, okay? I'm here to talk to you about this drug today. This is what I want to tell you." I tell them A, B, C, and D. Thank you, doctor, and then I leave. That is called information dump. That is not an effective sales call. That will not make you the money that you have the potential to make. When you go into a physician's office, your goal is to find out what that physician's needs are, and your job is to meet those needs. So if the doctor wants to talk to you about formulary, does anyone know what a formulary is? Okay, a formulary is a program that is designed to let doctors, consumers like you and me, patients, know what is available as far as drugs. So for example, I'll use generic drugs, okay? So you want Advil, you want Tylenol, I want Aleve. I go to this doctor, I have a particular managed care account, you have a different managed care account. Aleve is covered on your account. I want Tylenol, I can't get it.
Thank you.
Okay, so a formulary is basically, it tells you what drugs are available based on the plan that you have, and everyone is different, okay? So now, if the doctor's patients have Aetna or United Healthcare, and I have a drug that's not on those two formularies, it's going to be very difficult for him to prescribe that drug, because when he prescribes it and the patient takes the drug to the pharmacy, it's going to get rejected. Or the patient's going to have to pay exorbitant amounts out of their pocket if they want it. So if you go in and you want to talk about the efficacy, which means how effective the drug is, if you want to talk about that, but the doctor wants to talk about formulary, if you're on your own agenda, you are not going to make a sale that day. So your goal at that point is to address the doctor's needs the best you can with the tools that you were given by your company. Once you are trained, once you get experience, you will know how to handle these type of objections or these type of obstacles. okay? So once that's done, then you move on to, and doctor, in addition, I'd like to talk to you about why this drug is better than another. Okay, does that make sense? All right, so you don't go in there on your own agenda. All right, so let's get into some of the perks. All right, I mentioned a company car, not a benzo. Someone mentioned benzo. Usually, you know, it's a standard car, but it's a brand new car, and it's free. Well, let me. It's not actually free. Money is deducted out of your paycheck every week for that car, but it's not to the extent of a car payment. It's for tax purposes. So for all intents and purposes, it's a free car. You get a company car. You get a gas card with that car. So you use that car on the weekends, you use it during the week for work, you get gas anytime you want. Just for that car though, not for your mama's car, and not for your boyfriend's car or your girlfriend, okay? You get an expense account that I mentioned where you have funds to buy your customers lunch or dinner or breakfast, and that enables you to get more time to talk with the physicians, okay? No 2 days are alike, and the most important, helping patients. And let's not forget, you have unlimited earning potential. So let's get into the money. How much money do you make as a pharmaceutical sales rep? All right, so first, one of the requirements, you have to have a bachelor's degree, okay? 4-year college. If you have a degree in the sciences, that's great. That's better. However, it's not a necessity. You can have a bachelor's degree in engineering and decide one day, I want to do pharmaceutical sales. All you need is a bachelor's degree, okay? Once you have an interview and you get the job and you get into the industry, you are going to be expected to take tests, to study drugs, to study the competitors. And with this, you are armed with the information you need to go into these offices and be effective, okay? So, incoming rep, just out of college, maybe you have some experience working in other fields, you can look to make about high 40s, $45,000, $48,000 a year.
Question.
Okay, yes.
In our medical academy, we have pharmacy tech, and you said the requirement would be a bachelor's degree. So coming out of 12th grade, they're getting hired by Walgreens. Say they work 2 years as a pharmacy tech, and they still don't have a bachelor's degree, but they have experience in the industry. Could they realistically become a specialty?
That's a very good question. That's a very good question. It's my first question of the day. The group I had before, they didn't have a question for me. They just sat there. But anyway, this group will be better, right? The answer to that question is it depends. 9 out of 10 pharmaceutical companies will not accept a rep without a bachelor's degree. Even if you have pharmacy tech experience, that will help you. But there are a few pharmaceutical companies that will accept it, because the point of wanting someone who has a bachelor's degree, it's not so much the degree itself in itself. What they are looking for are people who can commit to something and stick with it and see it through to the end. So with an associate's degree, that's a 2-year degree, right? So yeah, you put in 2 years, you got your associates, and then you're done. But with a bachelor's degree, to put in 4 years, it takes a lot more commitment. It's twice the time. So that's what they're really looking for. And then remember, this job requires studying. You have to know pharmacokinetics. You have to know how drugs are metabolized in the system. You learn about, circulatory. I mean, it's not medical school, but there's a lot of science that you learn, and you have to know this stuff in order to be out selling effectively.
We want to start out by telling you exactly what dentists do. Dentists diagnose and treat any of the conditions that occur within your mouth. So whether it be on the teeth or the gums above, we are in charge of making sure that you're maintaining good health as much as possible. So one of the main points that we focus on is prevention as well. Preventing in the terms of constantly making sure that you're brushing, flossing, and keeping everything as clean as possible so that bacteria can't grow on your teeth.
About how many times do you guys brush a day?
2.
That's great. 2. Perfect.
For 2 minutes each.
Yes.
Yes, you'll get there.
So you should be. So 2 times a day, about 2 minutes each time. And the reason for that is if you do that on a daily basis, in long term, you will not have cavities, you will not have to go and get fillings, and will not have to get root canals. You'll keep your teeth as healthy and as white and bright as possible. Okay, and as dentists, you're the positive role model in your community where you encourage everybody to be healthy, and you're able to take them out of pain immediately. Have any of you had a toothache before? You have. Do you still have them, or
once in a while?
Did you go to the dentist at all, or just kind of went away?
No, my dad told me to take painkillers.
Okay, and that helped. So another way to take care of that is actually by going to the dentist and having them take care of maybe the bacteria that's in that tooth that's causing a cavity for you. Okay? And we chose to go into dental schools for these reasons. We're able to take somebody out of pain immediately. We're able to be positive role models in our community and encourage everybody to be healthy and active members of their community as well.
So some of the things you want to do to get started for a career in dentistry is you want to start early, which is great. You guys are doing exactly that by getting this information here today. So right now you're in middle school. Once you get to high school, you want to start focusing on some more of the science courses. You want to focus on taking advanced classes. Those kinds of things are going to prepare you for college. Some of the extracurricular things you want to do to prepare is shadow a dentist, to get to know what it's like, a day in the life of a dentist. You can call them, ask to shadow for a few hours, see some of the things that they're doing with their patients, even just talk to them, ask them about their experience, and you get a lot more information
And
that
they're
way.
very willing for you to come in. All you have to just pick up the phone and, hi, I'm so-so, I really want to see if this field is right for me. Would you mind if I come and spend a few hours in your office and, watch how you work and how you interact with, the people that work in your office and your patients? And they'll be more than happy to do that for you. Good morning.
Good morning, I know. Well,
it's in the afternoon.
I know.
It's the morning?
Okay, so I know Mrs. Bradshaw usually has been asking the question to get things started. How many have been to the dentist recently?
Very good.
How long? Is there a reason you haven't been to the dentist in 5 years? You don't have insurance? No, I want you to know that that's an excellent answer, because a lot of people don't have dental insurance. And we're going to talk about our professions first before we get into the politics of dentistry. But we'll tell you a little bit. Would you like to start off about yourself and your profession?
Okay. My name is Colleen Bradshaw, and I am the department chair for the dental assisting program at Palm Beach State College. And a little bit about dental assisting. How many in here have gone to the dentist recently? Okay, what did you have done?
I had my teeth get x-rayed.
Okay.
And I had it cleaned with a little metal, with plain metal.
Yeah. The chances are that was the dental hygienist who did that. Dental assisting, they can take radiographs as well. So there's a lot of overlap between the two professions, and you'll probably see that as we go on a little bit. Who over here? What did you have done?
I had a cleaning so I could get fitted for my braces.
Okay. Cleaning would be a hygienist. You may work with the assistant when you get your braces on, because they can tighten the bands and things like that. So
you had fun. You had impressions taken.
Yeah. Oh, and yeah.
And again, either hygienist or assistant can take those impressions.
How about you? What did you have? Okay. Cleaning would have been the hygienist. The filling would have been the dentist. And working with the dentist would have been the dental assistant. Okay, so there is a lot that we do as dental assistants that does overlap with dental hygiene. We both will take medical history. We learn how medical history, office emergencies, that kind of thing. We both will give patient education. There is a group of duties called expanded functions or expanded duties that both the hygienist and the dental assistant can perform. Each state is different, so we obviously follow what the state of Florida says that we can do. But with that, and too, with both of the programs, with your education, You can also go, and it's not just clinical in a doctor's office. You can work for the VA, you can work for the Department of Health, you can, oh gosh, there's so many, you can be a product rep. There's a lot of different things that you can do with your education. Again, a little bit about, go ahead.
When you say product rep, that means like toothpaste and stuff?
Sure, Crest. You know, you can go around to different, there it goes. You can go around to different offices and tell them what's new in the toothpaste world. You know, down to implants. We do a tour with 3i Implant Company, which is a local implant company right here. They make, it's a factory. You can do stuff like that. So there's a lot of things that you can do with your dental background besides just working chairside.
Mouth. Okay, so we do medical history, we do cancer exams, we do dental charting, certainly we do dental cleanings or scaling, of your teeth. We provide fluoride treatments. Does anybody know what fluoride does?
Oh, no.
No? Did anybody have a fluoride treatment? No? That at the very end, something that maybe they swab on your tooth or a tray that you had to sit with. Okay, it makes the tooth stronger. Okay, it's a real short, it's one of the simplest things we have in this country, this world, that could prevent decay. And that's what we want to do, is prevent decay, prevent the dental disease. But we do fluoride treatment and varnishes, and we also apply sealants, which is something kind of like a clear surface put on your tooth, again, to prevent decay. So there are a lot of services that the dental hygienist can provide. And again, it's a member of the team. We're looking at the dentist, the dental assistant, the dental hygienist, the front desk person, the office manager. There's a lot of opportunities. It doesn't have to be in a dental office. And that's what a lot of people don't realize, and they're opening up these opportunities. You may possibly work with public health, at the VA, at the Caridad clinic, at a nursing home, in a public school. You can go into the dental product area, corporation. You may want to go knock on dental offices and sell your product to them. You may want to go into research. There are so many things we're learning about medicine, and I don't have to tell you that the advances in medicine are tremendous. Well, the same thing's happening about the mouth. Things that we're finding out. They're working on a little piece of paper that you put in your mouth, in the saliva, that could tell a patient whether they have diabetes or not. I mean, just coming into a dental office for a checkup, wouldn't that be great? So there's a lot of things happening, but how are they going to find that with this little piece of paper? Does they just pull it? No, it's research. They have to make it, they have to produce it, they have to do tests on it. So that's a whole nother opportunity for you as far as jobs. So there's a lot of different roles that you can go into. Political, representing healthcare.
But now we have something that is called facial orthopedics, that is like moving the jaws themselves and the teeth with appliances that are functional. It's like having braces for your arms or your feet or your legs when they are bowed. They put braces in there, like braces that are orthopedic, that would line up your legs or your spine when you're humped up or something, or you have some kind of scoliosis. They put a brace to straighten your spine. The same way, it's done for the face, and it's called facial orthopedics. It is functional appliances that are like a brace that would be inside the mouth and aligning the upper jaw with the lower jaw, and then aligning the teeth as well.
Right. So usually you come to your general dentist for your regular checkups, and then we evaluate your bite, take care of any cavities, any gum disease, and then we'd refer you to a specialist to take care of correction of your jaw. Yeah.
But definitely your normal occlusion, normal face, normal soft tissue profile relationship, so you would not need orthodontic surgery. Okay.
But the first place to start is your general dentist. Yes.
Mm-hmm.
Yeah. Because also when you're going to have whether surgery or ortho, you want to restore any cavities that are there. You want to take care of all the cavities first, because you want to have a healthy mouth. And that's, and going back to dentistry as a career, that is our objective all the time. we're getting patients back. When a new patient comes into my office, the point is to get them back to complete restorative. So we don't like to see a patient that just comes in for a toothache here and there and just never comes back. We try to educate and teach patients to care enough to want to comprehensively take care of their mouth.
In 1996, we came up with a new therapy called HAART, H-A-A-R-T, highly active antiretroviral therapy, where we used a combination of 3 drugs, and it was very effective. And people started to live longer. And even though the number of pills, maybe 60 pills a day, but people were living longer. Now today, the drugs are so well made that 3 drugs is now combined to 1 pill a day. So take 1 pill a day, you don't have that much side effect, and people are living longer. So people can live as long as they want to live these days. People die from old age. They don't die from HIV anymore. So you see someone like Magic Johnson, he has HIV. You look at him on TV, it doesn't look like it. But that's what you see today. So if you take care of yourself, take medication, you can live a healthy, long life. So that's what HIV is today. So let's talk about some facts about HIV. Can people who are infected with HIV come from another country to the US? Yes or no? Yeah, years ago they couldn't do that. If you had HIV, you won't be allowed to come. You were not allowed to come into the country. And when you did, we tested you. If you're positive, you had to show that you're under the care of a doctor. But the president said this is not a good move. This was discriminatory in nature, and we changed that. So now, if you're infected with HIV, you can still come to the country. In the U.S., blacks account for most of the newly diagnosed infections. So that's something you need to really be aware of. And when you look at the population, I think the next slide will show you that. Oh, before I go into that, if you look at people between the age of 13 and 64, CDC said if any of those people end up in the healthcare system, either at the emergency room or doctor's office, they should be offered HIV testing at least once. Because we know those people are at risk. The older people, who are now, they are widowed, they're not having sex again, they're at risk. The young folks like yourself, who think you're indestructible, invisible, with their sex. So we're encouraging you between the age of 13 and 64 to be tested if you should encounter us somehow in the healthcare setting. And if you look at between 2008 and 2011, if you look at people between the age of 13 and 24, by ethnic backgrounds, blacks account for most of those new infections. Next is Hispanic and then whites. But if you look at the population, if you look at how people get infection, well, most people get infection by men having sex with men, and then the heterosexual contact. Notice we didn't say gay or homosexual because men having sex with men, most of these folks are not, they don't consider themselves as being gay. So a guy who has sex with another guy and then maybe a few times can have a girlfriend. So if you ask him if he's gay, he says he's not gay. So we really don't want to use that term because then we're missing people. So that's how most people get infected between that age group, between 2008 and 2011, and that's still the same today. Yes, please.
These data are based on reported cases.
Right.
Is that right?
Correct.
So the cases that are not reported, they will reflect as less cases for any particular group.
Correct? Correct, but however, the way these things are being captured is very simple. If you do an HIV test and it's positive, the lab has to report that data.
You're supposed to.
Yes, they will. All labs will report that data.
And I say supposed to because a lot of physicians are doing HIV tests in their offices. They're not doing them through a lab. And then we have the people that account for the in-home diagnostic kits that are testing themselves. Okay, so that's what I'm getting to. And I want to ask another question. Has the case definition for
aids changed?
No.
You're gonna try to get those candies, all 4 of them, on your spoon. At the same time. At the same time, scoop them all up. If you can do it, you can eat them. Ready, set, go.
Do you guys know anything that word adventure? No?
I hear you got the thing to the side, so she lucky.
Exactly.
Nice.
So why do you think this thing to the side is for?
To help you help scoop
To help you. So if I've got one hand,
You can put it on the wall.
now I can eat.
You can put it on the wall, then like it'll just go on.
It'll just go on there, right? And look, she's hungry. She hasn't eaten at all.
This is a grip strength test. So what you're gonna do is you're gonna just squeeze it as hard as you can, and then it measures your strength of your grip. So go ahead and give that a try. Just squeeze, good, and then you can let go. Good, so you did 50 pounds.
Oh, I only put half strength into it.
Oh, okay.
I just barely squeezed it.
Yep, so you got 64. You wanna try one more time? Yep, just squeeze one time as hard as you can. Good. And you also got 64. Good. So we can measure that and measure how strong you are. If you have an injured wrist or we're trying to get you back to normal, we can do both sides. This is the same thing, except it's with your thumb.
Right, so we have this right here, which would be like, what do you think this would be used for? So if someone might have had a spinal cord injury or back surgery or something, we might put them in this to kind of help with the healing process so they don't move in a way that's going to hurt them even more. And you were right, yeah, these are used for the legs. If someone needs help walking or some of their leg muscles are weak, we might have them wear these.
Have you guys ever seen these before?
Those are wraps.
Right. And then some of this other stuff is used for strengthening exercises. So if you feel this band, it's actually really hard to move.
So everybody has a piece of candy, right?
So that's for patients who do have more strength. And whereas this one's a little bit easier, so we would progress patients that way.
It's pretty hard.
Can you tell that this one's harder than that one? Yeah. And then we use, some of these are kind of heavier. Feel that one, it's a medicine ball. And we can use that to strengthen certain muscles if patients have weakness. Yeah.
I'm not very good at it.
And then we also have things like this thing you could step on with your foot, and then
It's
if
heavy,
you
isn't
wanted
it?
it to strengthen the arm muscles,
You might have
you would
that
pull up
strength
like
with those
this.
muscles
And we can
throw
make it
back and
harder if I
forth, you
step
can do
out
different
here,
exercises
then it makes it a little bit harder, the resistance.
Yeah, you can try one of these too if you want. This would, yeah.
I see a hole that's right here. Like 2 holes. There's 2 holes right here.
There's supposed to be a professor.
There's a bag.
You just
Make sure you don't put your thumb on it.
Dr. Roger Duncan. He is a physician over at Palms West Hospital. Thank you so much for allowing us to talk to you. What's it like talking to these kids? Are you impressed with their level of knowledge? I know a lot of them are involved in their medical academies at their individual schools. What are some of your thoughts about these kids?
Well, I'm very enthused that so many kids are here questing for knowledge and to learn about the variety of different health careers that they could become involved in. I'm also the president of the TLJMS Jefferson Medical Society, who has put the event on, and we're very enthused that 32 different exhibitors are here to talk with the kids, not only about being physicians, dentists, pharmacists, but also hospital administrators, insurance company executives, and a whole plethora of different career opportunities. And the kids are really asking a lot of fantastic questions and really being very enthusiastic about the opportunity that they've been presented.
You know, if you have an opportunity to talk to these kids one-on-one, what are you telling them? What are some things that you want them to think about as they try to achieve some of these goals and quite possibly, you know, be the next doctor?
Well, the fact that there is no free lunch, that it's all about delayed gratification, that it's a lot of books, a lot of studying, but that it pays dividends for them to stick-to-itiveness, and that there's a place for everybody within medicine. With or without a stethoscope, you can have an effect and transform healthcare and science here in the United States.
And you know, Scott, a lot of times when we think about young people, you know, sometimes we think maybe they are lacking in direction. What has been your experience with talking to kids? I know you deal with them obviously on a daily basis as an assistant principal. Are they driven? Do they have some clear goals in mind as far as what they want to do in the future?
Yeah, so Inlet Grove is a charter school, so kids that are here, you know, they want to be here. They want to be in these programs, especially the medical program. It's one of our largest. And so the kids that are coming here, they're motivated, they're excited, they want to learn, and they're hearing it from doctors and nurses who teach our classes.
Francisco, tell me, it seems like the kids are also having a pretty good time. I mean, it's pretty fascinating just to go into that one last session with the operating room techs, to kind of hear all the inside stuff of what goes on. It seems like it's been a really good experience. It's almost like they don't even realize that they're learning so much, right?
Absolutely. One of the things that we want to focus is that learning has to be fun. It can be fun, and we are doing it right now because the kids are learning about different professions, but they're having fun, manipulating the different instruments, being involved with discussions with professionals. So it can be fun, and we're having fun doing it.
Yeah, it really is a great atmosphere over here at Inlet Grove High School. Thanks to both of you guys. Fantastic job. I know the kids are getting a lot out of it. Thanks again.